Thank you, Mr. Speaker. Men and women of the House, I rise in support of the pending motion. I'm going to try to be brief. It's been a long debate and a lot of information has been thrown around back and forth. We've heard a lot of myths. There are a lot of myths around expansion. I'm going to try to address a couple of them. I'm not going to hit everybody's points. But the first myth we continue to hear is the one I refer to as the myth of the cannibal. It's about Medicaid spending and its impact on our budget. But here's some important points that I think people need to remember, some facts. Again, since 2009, spending on Medicaid in Maine has remained flat. Since 2012, our Medicaid enrollment has gone down over 10%. This year, we will realize the savings in our budget because the federal match rate is going up. Through the first 6 months of this fiscal year, spending in Medicaid has increased 0.1%. So spending is flat, enrollment is down, federal match is up. Maine spending on Medicaid per capita, per recipient, is the lowest in New England and 26th nationally. Not much of a cannibal, if you ask me. The other myth we keep hearing about is about the cost. And again, I'm not going to spend a lot of time talking about the cost. We've heard about all the studies. Virtually every study, whether independent, from sources that are considered progressive, sources are considered conservative, indicate that Maine is a winner in expansion from an economic perspective. We've heard about the jobs. We've heard about the impact on our healthcare community. The one outlier, of course, is the Alexander report, which people opposed this motion continue to cite. I would argue that report has been tremendously discredited and revealed for the partisan work that it is. But I hope folks will take a few minutes. You can see my copy is all marked up, and take a look at the fiscal note that OFPR put together. And again, I'm not going to go through this line by line, but OFPR prepared this fiscal note like it prepares every other fiscal note. It priced to the bill. It priced to the language in the bill, including the sunset, which is in the bill. This body and the body down the hall will have to take an additional vote if we ever choose to go forward after 3 years. But the fiscal note is pretty clear that this is going to save money. In the first year alone, there will be budget savings in the current budget of $3.4 million, and savings in the next year also. But there's a myth out there that somehow information from the Department of Health and Human Services has not been taken account and has been ignored. Again, I would ask folks to take a look at this. It shows how they use the department's numbers. There's a lot of detail in here. It shows how, again, it acknowledges the fact that there's a small percentage of people who are going to get the regular match rate, while the vast majority of people are going to get the 100% match. It talks about the woodwork effect that the representative from Hancock talked about. OFPR took all those things into account and explains all of that here. It did not ignore the information from the department. And as a matter of fact, it's very clear here how it accounted for it. So the other myth that we hear about is that individuals can use subsidies to purchase a plan on the health insurance exchange. Well, again, if you're below 100% poverty, 100% or below, you cannot go to the exchange. So to the extent that people think that's a solution that leaves about 24,000 Mainers out in the cold. The 24,000 poorest, most low-income Mainers, people under 100% of federal poverty level, people making, basically under $11,000 a year, will be left out in the cold if we don't expand. For those that do qualify, again, people roughly in the range of $12,000 to $15,000 a year in income, they'll be forced to pay copays and other cost sharing. But one thing is very clear: we cannot do a partial expansion under federal law. One of the representatives suggested that under the ACA, Maine is looking pretty good, that we're faring pretty well, and I think we're all encouraged by some of the numbers we're seeing about people going to the exchange. But I would say that we took a big step backwards because actually, while other states have actually been enrolling people under expansion, we actually threw thousands of people off of MaineCare on January 1st because we didn't expand. The other myth, the other thing we talk about are, the impact of expansion on the wait lists. And I think we are all in agreement that we need to do something about the wait lists. But as I mentioned in response to one of the questions we received, this bill actually requires the department to come up with a plan for dealing with the wait list. The department doesn't have a plan right now. The department's been directed to do things over time, haven't necessarily done them. I think we all acknowledge that Maine's costs for providing services under these waivers are higher than costs in other states. And this actually requires the department to go out and manage the population so that those costs can go down, so that more people can be served. And I want to point out that, there are people who are in this building very often who advocate very strongly and very strenuously for elders and for people with disabilities. And they talk about the wait lists all the time, not just when it's convenient for them to do so because they're trying to offset something else that they don't like. And I want to point out that Disability Rights supports this bill, that the Maine Association of Community Service Providers supports this bill, people, again, who advocate strongly for people with disabilities. With respect to seniors, AARP supports this bill, I think as many people know. The Maine Association of Area Agencies on Aging. If you look at the list of people who testified in support of this bill, if you look at the people who are members of the Cover Maine Now Coalition, you will see people who advocate strongly on behalf of people with disabilities and elders supporting this bill. So, the people that are going to receive the benefit of this, we talk about, the folks who are able-bodied. 65% of Maine's uninsured population lives in families where someone is working full-time. This is primarily a population of people who are working. These people work in industry sectors, including accommodations, food service, retail trade. A lot of them are actually home health aides, the people who actually provide services to the seniors and the disabled population that we're trying to help here, or that we profess to care about. Those are actually people providing the services that would actually benefit from expansion. But generally, these are people who work low-income jobs. The Great Recession hit them extremely hard. They haven't necessarily recovered. And again, I'm hoping that we're going to be able to pass this today and give them some support. So I'll just wrap up really quick. We've been having this debate for a long time. This debate has gone on in this country for a long time. And we talk a lot about what other countries do with respect to health care. And I've always told people, I don't really care what other countries do. I don't care what happens in England or Canada or France or Japan or Norway. I care about what happens in America, what happens here in Maine. We should be leading and following. We should be leading this. We shouldn't be following this. We have genius scientists who would develop pioneering drugs and technology. We have brilliant clinicians and doctors and surgeons who can keep people alive longer and healthier than our parents and grandparents could have ever imagined. Yet this treatment is unavailable to millions of our own people because it's expensive. And millions go without basic care because they don't have insurance. We've created this have and have-not society where we decide that some people are worthy to live and others we just let die because they don't have enough money to access the phenomenal care and technology that we ourselves created here in America. It's really something like out of a Dickens novel as opposed to a 21st century democracy. And we should all be ashamed and outraged that it's gone on this long. The time has come for all people to share in what we've all created. Our healthcare system shouldn't be picking winners or losers, people who live and people who die, based on how much money they have in their pocket. But we can take a great leap forward in Maine towards fixing that problem by voting yes on this bill today. And I hope that this bill will get large support from this body today, Mr. Speaker. Thank you.